Welcome, and thanks for joining us today. If you're watching this video, you or someone you know is likely living with diabetes. This is the first video in a series of posts that will be published by Chase Medical Research addressing topics related to diabetes. If you're living with diabetes and would like more helpful information, be sure to subscribe to our channel or visit chasemr.com. So in this video, we'll cover some of the challenges faced by diabetics today. We'll also talk about the diabetic patient-physician relationship, how patients can make the most of their treatment in the time between physician visits. So with that, I'd like to introduce Dr. Joseph Soufer of Chase Medical Research in Waterbury, Connecticut. Dr. Soufer practiced medicine for over 30 years prior to transitioning his professional career to full-time medical research in 2012. He has a wealth of experience and works with diabetics on a daily basis. And so we're happy to have him here today. So welcome, Dr. Soufer.
Thank you very much, Winston. My pleasure to be here.
Great. And so, Dr. Soufer, you work with a lot of diabetes patients, and tell me, what are some of the biggest challenges that diabetics face today?
Well, for most patients, whether they're newly diagnosed or have had diabetes for quite some time, it's understanding what diabetes is all about and also accepting the fact that they do have diabetes. These two issues are a constant problem for most diabetics, but once they overcome that, they begin to realize that it's not such an overwhelming disease and it's something that can be controlled. We try in many different ways to bring this to their attention. The education component of it is a challenge for both researchers and practicing physicians, and I'll talk more about that. And then the acceptance and trying to deal with it alone as a diabetic is another challenge that I'm going to try to give some advice as to how they can work around that as well. The first component, which is acceptance and understanding, involves the amount of time, for example, that the patient with diabetes has with their physician. In most instances, if we think about how much time a physician plays with their contact with the diabetic, you have to think of it in terms of the number of visits per year. So for example, if a typical diabetic sees their doctor twice a year, that's really equivalent to maybe 30 minutes a whole year. If they see their physician 4 times a year, that may be equivalent to maybe just 1 hour a year. And when we think about it, is that really a sufficient amount of time to dwell into the complexities of a disease that most people need hours and days and weeks of time to understand, even for a physician? So right. There are ways of working around that, which I could allude to as we speak.
Yeah, that's great. So with such limited exposure to doctors, how can diabetics sort of make the most of that time in between physician visits? What are some things that they can do to help adhere to what the physician has recommended and to help maybe improve their situation?
Well, there are a number of ways. For example, making sure that they see a dietitian once or twice a year. The dietitian can review their diet, go over their meal plans, make sure that they're reinforcing what they've heard from their private physician. Most of the time, the physician will give them general, broad viewpoints in terms of what they need to avoid, but not really have the time to dwell into specifically for their particular diet and their preferences what to avoid. So by seeing a dietitian, they can get a good idea, depending on the ethnic background of the patient, what type of foods they do enjoy and what they can substitute for. So by having that contact, it already helps them to solidify what they've heard from their own physician. The second way is seeing a diabetic educator. These educators are specifically trained to work with diabetics in order to educate them about what's already been established about diabetes and also some of the newer things that have recently come out about treatment for diabetics. The third thing is actually seeing an ophthalmologist at least once a year, whether or not they have eye disease or not. The leading cause of blindness, for example, in America is due to diabetic changes. So once they see an ophthalmologist, that's another opportunity where they can review their diabetes with them in order to get insight into how well they're doing. Another way is seeing a podiatrist at least twice or three times a year, because as most diabetics fear is their potential loss of a limb. Now, that comes from poor circulation that occurs in the lower limbs, and a podiatrist not only looks at their toes, but also checks their circulation of their feet, in addition to what their physician may do once or twice a year. And that, again, is an opportunity for them to learn more about perhaps some of the changes that have occurred in the diabetic area. And lastly, actually going to a gym, because exercise is a very important component of it, whether one gets a trainer or not, but going to the YMCA or any health facility where they can work out, they may begin to talk to other diabetics and actually learn about how they can network with other diabetics through senior centers where they may be able to meet other senior citizens through support groups that are also available.
Great.
And more importantly, I should add one other thing is the relationships within their own family. Being able to have the opportunity to talk to their family members about their condition and getting the support from their family so that there is constant feedback.
Yep. And so with exercise and diet concerns and some specialists that diabetics might need to go see in between regular physician visits, what specifically can family members do to kind of help them stick to the prescribed regimen that their physician has set forth?
Well, it's very important that if it's a spouse or if it's a sibling, anyone who they may be living with, has an idea of what medications they're taking, because it's very easy to avoid taking a multitude of medications that have been prescribed to them. So if there's someone working with them or keeping an eye over them, making sure that they're taking their medications more or less at the same time, not skipping any medications, that helps to improve the communication. The other component is diet. Of course, if they're supportive in helping them avoid to buy certain foods at the supermarket so that they can avoid simple sugars and certain fats, that's also very helpful. If everyone in the family is having sweets and cakes and ice cream, it's very hard for a diabetic to avoid those things. So having a supportive family that can oversee what kind of foods are being bought and brought into the house becomes very important.
Yeah, great. Okay, good. And any other advice for diabetics or types of information you think that they might need to know about how to maximize what they're doing in between physician visits that we haven't already covered today?
I think we've covered most of them. I'm sure that there'll be some things that people will adhere to. It'll be easier to go to an ophthalmologist or podiatrist, but for some people, their insurance may or may not cover it. With the new healthcare laws, it should be easier to have access to those people. So in our next section, I'd be more than happy to talk about some of the newer therapies that have come out.
Great. Awesome. Well, Dr. Soufer, thanks so much for your time today. I think you shared some really great information that I think is going to help a lot of patients dealing with diabetes.
Thank you very much.
Great. And So as a reminder, we'll be publishing additional videos, so be sure to subscribe to our channel, like us on Facebook, Chase Medical Research, or be sure to visit our website at chasemr.com to learn more about us and read some blog posts with some helpful information for diabetics. Thanks for watching, and we'll see you again soon. Thanks so much.
Okay.